Hi, good day everybody. I'm gonna try to refine some of my earlier videos, and also the main purpose of this video is to show you Vantelin knee and ankle supports, as well as the compression calf sleeve. Again, you would have seen photographs of them in my Facebook posts. I'm gonna show them on video today, and I'm gonna refine my earlier video on how to put on the Vantelin standard knee support or cool fit support in such a way that you can actually try to lift up your kneecap anteriorly away from the tibia and the femur. I'm going to show it to you in a moment, so that you increase blood circulation deeper into the knee joint, improve tracking of the kneecap, while the fabric, the special fabric, which has sports taping principle embedded within the fabric, stabilizes your knee from torsion, twisting, that would damage your knee, but allows for full flexion and extension in full range of motion, so that your movement in sports or everyday wear, whether you're wearing it for a walk or to the office, doing gardening, for example, where you have to squat down, if you have any kind of knee pain, that would elevate the knee, promote tracking, stabilize your knee from torsion, twisting, but allow for full range of motion, so you're not impeded in your movement, whether at work or at sport, or you're just working within the house or in your garden. So the first thing I'm going to show you is why use Vantelin standard knee and ankle supports. Because this fabric is not an ordinary fabric. Even though it's made of lycra and it is thinner than most materials, for knee guards, knee supports, and ankle supports, and wicks sweat to the surface much better than most materials, because this is lycra. But within this lycra, you have embedded within sports taping principles. So, meaning that the direction of the pull within the fabric is designed to support the knee, while at the same time stabilizing it from torsion, as mentioned earlier. And the fabric, because it is lycra, it allows for full range of motion in flexion and extension. So this is so for both the knee and the ankle supports, as well as the compression calf sleeve, which I'll show you in a moment again when I put it on. So why use Vantelin knee and ankle supports and compression calf sleeves? Because these are based on sports taping principles in the design within the fabric. They're not just one piece of compression device that is either too thick, that restricts range of motion, too warm because it doesn't wick sweat away as well because they're too thick, and because they're just a band of material that has no sports taping principle at all. So I can't speak for other brands, the amount of sports taping they put into their material, but I can tell you that in Vantelin, we have sports taping principle within the fabric. And that's what's unique about it. As you would have known from my previous videos and from a photograph I posted on my certification on kinesiotaping, that I am a certified kinesiotape provider. In other words, I'm certified to provide kinesiotaping for athletes, for people with injuries, and those with chronic pain anywhere in the body. So let me show you once again. I'm going to revise for you how to put on the Vantelin knee support, whether it's standard or the cool fit version, the cool fit version wicks sweat away and keeps the material, keeps you cool. Now this is of course the ankle support, but the knee support has a similar look to it and feel, of course, because it's cool fit. So it keeps you cooler while you are exercising, while you're playing sports, if that is your goal. But even the standard material is already very cooling in the sense that it wicks sweat away very well, very efficiently. So you don't really need the cool fit. The cool fit has just that extra cooling property. Okay, so you feel cooler in this. So how do we put on the Vantelin knee support in order to make use of the kinesio taping principle that lifts the kneecap anteriorly? So normally, what would happen is you would put on the knee support this way, and there you have it. I know you can't see it very well, but if you just put it on this way, this is what it's going to look like. Okay? And this is going to provide a fair amount of support already. Very good support. Because this stabilizes your knee from torsion, which, as we have said, torsion destroys your knee, especially for the meniscus. Twisting of the knee normally damages the meniscus if taken too far. So the knee, if you remember our joint by joint approach, the knee is supposed to be a stable joint. The ankle is supposed to be a mobile joint, and the hip is supposed to be a mobile joint. So it's alternating in function. So if the knee becomes damaged through twisting, then your ankle will become stiff in order to compensate for the lack of support, lack of stabilization, stability, and the ankle will become fixed. Similarly with the hip. Most of the time, however, it's the other way around, where the ankle, lacking in mobility, causes the knee to compensate and twist, thereby damaging the knee. Same with the hip. So today, in another video, I'm going to show you how to, once again, I'm going to refine the video on ankle mobilization, and then I'm going to show hip mobilization for the first time. If you remember correctly, ankle mobilization, I actually showed strengthening in the extreme range of motion in 7 different positions. 7 different positions. And with a modification of the ankle behind the body and in front against the wall. So we're going to do that again. And then I'm going to show you the different strengthening exercises in extreme range of motion for the hip. Okay? We're going to do that in other videos. So this particular one, I'm going to show you how to put this on. So if you want to lift up the kneecap anteriorly, this way, anteriorly, away from the femur and the tibia, what you're going to do is, in this position, you're going to roll it down until the top of the knee support is below the patella, below the kneecap. And then you're going to flex the knee. Now let me get something to sit on so I can demonstrate this more effectively. So you're going to flex the knee as much as possible. Notice this. And you've got to keep it flexed. If in this position I ask you to put it on, you straighten your knee, you put it on, and then you flex it. quickly, that doesn't do the trick. You need to keep the knee flexed as much as possible. Now this ball, okay, so you pull it up with the knee flexed so that the thin part of the material is again over the kneecap. And now you're good to go. It's that simple, but what a huge difference it would make, because now when you stand up, when you straighten your knee, you will feel the difference. When you straighten your knee now, you will feel that the material will grip your kneecap and push it anteriorly forwards, away from your shin bone and your thigh bone. Try it, you will see the difference. This is the principle of kinesiotaping, by the way. So, kinesiotaping is the original taping with this invention. Of course, now you have other tapes as well that mimic the kinesiotaping principle. So, once again, if you pulled it up, you roll it down, you want to flex as much as possible, and then roll it up again to your thigh. And now you're good to go, because now when you straighten, that material grips your kneecap and pushes it anteriorly or forwards, thereby aiming to improve blood circulation beneath, improve the tracking of the kneecap over the tibia and the femur. It continues to provide stabilization from torsion, twisting, which would wreck the knee. And you allow, because of the material, full flexion and extension for work, for sports, and whatever training you do or whatever chores you may be doing at home. Whether you're doing housework or you're doing gardening. So that is the Vantelin knee support. So what you will have is that the compression calf sleeve will actually help you to pump blood back to your heart, or prevent blood from accumulating, deoxygenated blood from accumulating in your ankles and your feet, causing tired ankles and feet. Now, here's the thing. When you put on your calf sleeve and you put your ankle, your heel, through the cutout portion, you will pull the rest of the sleeve up to just below your knee. Now, for those of you who are not used to this, of course, you're going to say it feels tight. It's meant to be tight, but please do not purchase one of these without measurement, because the sizes are all according to measurement of your calves and your knee and your ankle. So this is the compression calf sleeve, and what it does is that firstly it prevents blood from accumulating at the ankles and feet, deoxygenated blood, so you don't have tired calves, tired ankles and feet. But it also helps, because of the pressure on your calves, to pump blood back to your heart, because we know that systolic blood pressure is much higher than diastolic blood pressure, meaning that arterial blood flow has a much greater pressure. Plus, if you are seated or standing, you have gravity pulling the blood down. So this calf sleeve is a very sellable product, because this item, because 4 groups of people actually use it. One, professional athletes can use this because of the increased blood flow, and I'm sure you've seen professional runners and other athletes using compression devices. But Vantelin, being the #1 brand in Japan and having sports taping principles embedded within the cloth is my recommended product for you. Okay, so apart from professional athletes, you have even secondary school athletes that can use this, because one of the principles of the compression is that it reduces muscle vibration. Whenever we contract a muscle, you have tiny amounts of vibration that actually waste the energy you're expending. If you have wasted energy and you're playing a sport, that would mean you're executing your movements less efficiently. So this prevents that from happening. It increases your efficiency in the execution of your movement, whether your sport is playing baseball or cricket or running or hockey. This will help, because most sports require you to move around with your legs, right? So even if your legs are a stable platform, the contraction of the muscles in your calves will necessitate some sort of precision, because such movements affect upper body movement as well. So you understand that a compressive device that reduces muscle vibration will result in a more precise execution of whatever sporting movement you are executing, including, for example, golf. We know that golf, you're moving, you're thinking, okay, my feet are planted on the ground. Yes, you swivel, you move the golf club with your upper body, and you swing. But the platform that allows you to perform that swing is your legs. So if your legs are not stable, in the sense that if there's tiny muscle vibrations and you're wasting energy, then the precision of your movements will be affected. And if you're in endurance sports such as endurance running, wasted effort means that you're taking away from your ability to hold that running pace for longer. So this is why you see many elite marathoners wearing this as well. The third group of people, of course, are older folks who have a weaker heart. I'm not saying all old folks have a weak heart. If you know anything about me and this channel, you know that I promote a high level of fitness among people who are more senior, even in their 70s and 80s. And I've personally met them. So, in fact, just a couple of weeks back, I met a man in his mid-70s, 75, who was running and lifting weights. And I told him, your hair looked like that of a 50, 60, 70-year-old, right? Because there were many silver hairs on his head. His skin, because of the slight wrinkling, looked like that of a 50-year-old, but his body looked like that of a 20-year-old. Literally, his body and his muscles looked like that of a 20-year-old. So you see, I'm not saying that if your age is more advanced, that you're definitely going to have a weaker heart. But for those who do have a weaker heart, who haven't been spending consistent hours every day exercising, then you will see a common phenomenon where blood pools, accumulates at the ankles, right? So when this provides pressure on the calf, you'll find that minimizes the pooling of blood at the ankles and feet. Talking about that, the fourth group of people who benefit from compression calf sleeves, especially those of Vantelin, because of the sports taping principle embedded within the fabric, are people who stand all day long like myself. As a sales promoter, I have to stand for many hours in a day, and sometimes you will find people complaining about experiencing tired ankles and feet. And that tired feeling could be caused by deoxygenated blood accumulating at the bottom, right? Because of gravity, if your movement is restricted and you're not pumping the blood back to your heart, if you have deoxygenated blood, which means blood that has been used up for its oxygen, and they're not pumped back to the blood efficiently so that you have a refreshing of the blood in the lungs when it's pumped to the lungs via the pulmonary artery, and then you have that blood, undergoing oxygen gaseous exchange with the air outside that you breathe in. If that's not happening efficiently, and deoxygenated blood that is deficient in oxygen, accumulates at the ankles and the feet, you can have tired ankles and feet. So that's the fourth group of people who benefit from this compression calf sleeve. I'm going to show you now how to measure, because if you've seen one of my latest posts, I've offered to order any of these items for you and have them shipped to your doorstep. If you live in Singapore, shipped to your doorstep by Watson's, nicely packaged box, in a nicely packaged box. And all you need to do is to tell me your measurement, whether for the calf or for the ankle or for the knee, and you can pay me via PayNow or transfer it over to me, and I will place the order for you. If it is under $40 Singapore dollars, all you need to is to add on another $5 Singapore dollar delivery fee. Now, if you don't want that delivery fee, if you don't want to pay that extra delivery fee, then order above $40 Singapore dollars, and I will have Watson ship it over to you, deliver it to you in Singapore for no extra charge. So here's how you measure the 3 parts of your body that you may want to stabilize or compress. So for the knee, this is how you do it. You need a measuring tape at home, otherwise come see me at the store. So you're gonna place the measuring tape over the center of the knee. Go behind it, and where it ends, that's your measurement. All right, that's your measurement. So there are various sizes for different measurements, and I can calculate those for you. I can look at the chart and tell you what fits you. And all I need you to do is to provide this measurement of your knee for me, and I'll do the conversion for you, whether it should be a medium or a large or an XL, an extra large. That's for the knee, and that works for the standard knee support as well as the cool fit knee support. If you're talking about the compression calf sleeve that we just showed you, you need to measure the biggest part of the calf. So this is the calf, the widest part of the calf. Again, go behind, and where the tape ends and meets the rest of the tape, that's your measurement right here. That would be your measurement. So from a side angle, you're going to go to the widest part of the calf, and where it meets behind. Of course, you can also do it from back to front. That is your measurement. From back to front, it'll look like this. Okay? It'll look like this from back to front. So from back to front, this is how I know I'm obstructing your view. I'm not a very good cameraman, as you can tell from my videos. That's how you measure for the compression calf sleeve. And for the ankle, all I need to know is your US shoe size. If you give me your European shoe size, that would be fine as well, because I can do the conversion for you pretty easily. So just give me your shoe size. Tell me whether it's for a man or woman, that shoe size, and I'll do the conversion for you into the size of the compression calf sleeve. Okay? So for the ankle support, which again has sports taping principle embedded within the fabric, meaning it is woven in such a way that it prevents over tilt, over pronation, over supination, leading to sprain injuries. But it allows for full flexion and extension. Okay, so flexion, plantar flexion, dorsiflexion. Or if you want to use medical terms, it's flexion and extension. It allows for full range of motion, but it prevents excessive pronation and supination, or inversion and eversion. So give me your measurements for your knee, your calf, and your shoe size, and I will tell you what size you need for the ankle support, the knee support, and the compression calf sleeve. And I'll be back again with other videos with regards to the ankle mobilization as well as the hip mobilization instantaneously if you just click on the next video. Thank you very much for watching. This is Zui Lim. Enjoy your Vantelin supports.